We all use echocardiography and depend on it for our patients, but the question is it useful for screening in the general population? Now in JAMA, there is a report from Norway for more than 7,000 patients in the general population, half of whom had echocardiography as a general screening and half who did not. And then 15 years later, they looked at the outcomes. The outcomes, candidly, are a bit of a surprise. The bottom line here is there was absolutely no difference in outcome concerning mortality or incidence of cardiac issues, myocardial infarction or stroke. Echocardiograms were evaluated for the usual kind of suspects: aortic root dimensions, whether or not there was valvular disease, dimensions of the left ventricle and function of the left ventricle, and presence of atrial fibrillation. And despite knowing what was going on in some of those patients, there was no difference in outcome. Bottom line here, it seems that echocardiography is not a useful tool and certainly not worthwhile financially to do in the general population. On the other side of this question is something that is not answered in this report, and that is for high-risk populations, such as athletes who are at risk for sudden death, is it useful? Because Italian data have shown that it may be. More on this, I'm sure, to come. For CardioSource, I'm Peter Block.